Welcome to Brain Wellness, the podcast. I'm your host, Mandi NP. Each episode will bring you a new topic or interview related to brain health and wellness as part of my mission to help you on the path to a healthier, happier brain. So, let's get started. Hello, everyone, and welcome back to another episode of Brain Wellness, the podcast. We just had Thanksgiving this past week, and we are well into our full swing of holiday season. So many holidays coming up, and so much to be thankful for. So even though Thanksgiving is done, I still want to express my gratitude for all of you for listening and encourage you to think about gratitude as we move forward. I always tell my kids, well, one holiday at a time in our house. We only decorate for one holiday at a time. We don't decorate for Christmas before Thanksgiving because Thanksgiving needs to be there. You need to be grateful before you have things that you need to tell people things that you want for Christmas. So grateful for what you have before you get more things. That's what I always tell my kids. So it's what I'm going to tell you today as well. And I'm back solo again today this week. We've got some really good guests coming up in future episodes here, but today we're going to talk solo again. And today I'm going to share a little bit of personal experience as well as what I see with my patients on a regular basis. So this week I'm going to answer the question raised by myself, but what's it like going back to work with a TBI? So I've had this conversation a lot with patients as they come in, as they are getting ready to go back to work and they're nervous to go back to work. And what all does that look like? And so we're going to talk about that today. What does it look like going back to work after you've had a traumatic brain injury? Okay, because that experience of going back to work looks very different than if you took time off for a surgery or if you took time off to go on vacation. People go on extended vacations too. So what does that look like coming back to work from all those different things? So the first part of that we're going to talk about and tackle is what some of that looks like with those fears and anxieties. And actually, before I get into the show, I do want to give you one free request for you. So Black Friday, Cyber Monday, all those things with deals are past, so-called, because all the online stores still do all sorts of deals moving forward. But my one request from you is free. If you're listening to the show, if you like the show, please leave a review. Please follow the show on whatever source you listen to. Please leave comments. That all helps me be seen. It helps more people come to the show and listen to the show. So if you like what you're listening to, please do one of those things or multiples of them. Leave me a review, leave a comment, subscribe to the show. Make sure that it gets up on the list so other people see it as something that they might be interested in as well. So that's my request to you before we get started today. There's your commercial for today. And here we go with the show. So getting back to work with a TBI, traumatic brain injury, what does that look like? Again, so oftentimes there are some fears and anxieties related to getting back to work. And my patients often voice that, and I felt the same thing when I was getting ready to go back to work. I started questioning, am I really ready? So do you ever really know if you're ready to go back to work? And there's not really a 100% answer to this. Some of it is a little bit of trial and error. When you go back, you might not be ready. Maybe it was sooner than you really realized, but you were trying to get back and you were trying to push yourself. So that question is, am I really ready? No one can answer that question except for you. And you might not even have the answer to that question right off the bat. But you can't let that fear and anxiety of what might happen when you get back to work keep you from getting back to work. Because truly you won't know if you're ready until you try. And sometimes I'll send patients back to work and we will put some kind of accommodations or requests in place for extra break time or work in a quiet area, extra time to do their documentation if needed. But they are really adamant they want to go back for 8-hour days, or their employer is really adamant we can't take them back for less than 8-hour days. And you try to go back for 8-hour days and you find out that was too much. We really needed 4-hour days if at all possible. So then we need to back off. And that's okay. It doesn't mean you're a failure. It means that your brain is still healing and you need to give it extra time. So that shortened time period at work is enough to challenge you to the point where you can figure out where that actual benchmark is, but then still be safe enough so that you're not going to be suffering the consequences of going back to work and pushing through a really tough day when your body really wasn't ready to do that yet. And then on the flip side of that, sometimes you will be pleasantly surprised. I've had some patients go back to work at shorter periods of time frame and they come back and they're like, can I bump it up because I feel really good? And then we bump that up and we get them back to work faster because it's kind of like version of therapy when you go back to work. So all those skills that you've been doing with physical therapy, with occupational therapy, with speech therapy, all of those different things you've been working on, you get them all in one big fell swoop when you go back to work. And you are doing the things that require your vision, require your concentration, all of those things that are getting you ready to go back to work. You're doing them on a regular basis at your workplace, trying to get ready for the next big step at work or the next thing that you need to do. So all of those things are really good to talk about because, again, they get you ready for work. I think the biggest concern that I had when I got back to work, and my patients haven't voiced this to me quite as much, but one thing that I noticed when I got back to work is that when I was telling people that I was back to work, they said, well, great, that means you're back to normal. Well, no, that didn't mean I was back to normal. I wasn't back to work full time. I was back to work part-time, and I'm still working part-time 8 months into this. I'm still working part-time. So those work hours might not be what they used to do. So before my injury, I was working a full-time job. I had a part-time job. I had this podcast. We have 3 teenagers in the house. One wasn't quite a teenager yet, but we have 3 teenagers now. So we had all of these things, and I was training for a marathon, and had just recently stopped being a health coach. All of those things that I was doing took time out of my day. But I pushed through it. I did all of them on little sleep. Probably wasn't a good idea, but I did all of those things all of the time. And that was my schedule, and that's what I was used to. When I first got back to work, it was a couple days a week. And then we got to bump it up to 3 days a week. And slowly we bumped it up to 8-hour days on those 3 days. But I can't yet go beyond that. There's this little invisible line that my body doesn't want to cross yet, that when I try to do too much in a week, then I start getting major symptoms again. So I'm trying to listen to my body, but yet trying to challenge my body at the same time. So those work hours might not be what they used to be because your body's not quite ready to do those hours yet. And you might be back to full-time instead of part-time like I'm doing. Is it ideal? No. Would my bank account like me to be back to full-time? Absolutely. But my body can't do it yet. And I can't sacrifice my health for anything else at this point because I need to get better. I need to continue to grow so that I can still be there for my family, so I can still do the things I need to do for my kids, for my husband, and not put too much stress on everybody else around me. Because I'm that kind of person that's always thinking about others, probably to the detriment of myself, which is what I did prior to my injury. So trying to listen to those limits that my body is setting for me, but yet challenging myself enough to increase as I can is a really important thing. And getting back to work does not mean you don't have a brain injury anymore. And that's the other thing to remember too. So as people look at you and they're like, yay, great, you're back to work. That must mean you're back to normal. You're fine. You don't have a brain injury anymore. That's not how that works. Brain injury doesn't just go away at the snap of your fingers. It doesn't just go away when you clock into work that first day when you get back. That brain injury is still there, and it's still going to remind you that you need to take breaks, that you need to take it a little bit slower, that you need to listen to your body. And I think that's one thing I've seen universally when I watch patients go through their recoveries is that they do start to listen to their bodies and they start to be a little bit more in tune with what their bodies are telling them at different times. And if something doesn't feel right, they're usually the first person to know now. They weren't the first person to know before because they weren't paying attention to the signals that their body was giving them. And that's like I said, a universal thing that I see across the board when patients come in now. For example, one of the tools that we use in clinic is the Rivermead post-concussion symptom question. And we look at how severe their symptoms are every time they come in to see me. Sometimes after that first visit, their scores go up a little bit to the next visit. Not significantly, but like 5-6 points, maybe a little bit more than that, because now they're more aware of the things that we talked about last time. So many times patients come in and I'll ask them if they have double vision, if they have blurred vision, 2 of the questions on the questionnaire. They tell me no. And then I do my exam and I find out, yes, actually they see double quite far out. They're just not realizing that they're seeing double. And then we get them to the eye doctor and we get that improved and corrected. And now they're feeling better. They didn't realize they had that issue before. So now when I ask them next time they come in, are you having any blurred or double vision? Well, yeah, I realize that that's what it is now. So now we have a score in those 2 areas where we didn't have a score previously. So things change. Sometimes things get muddier before they get cleaner. And how I usually describe that to patients is it's like when you're cleaning out a closet at home. You have to make a mess before you make it clean, right? You pull everything out of the closet. So when you first come in for an appointment for a concussion, and we go through all the things that might be going on with you, and we go through all the symptoms you might be experiencing, that might bring some things to your attention that you didn't think about before. You weren't paying attention to them because you didn't think that they were problems. Maybe you came in because you have headaches and you're really tired all the time and you didn't realize that you're not seeing things clearly and you're not able to stand up very well with your eyes closed in my office. And all of a sudden, I'm giving you referrals to occupational therapy to work on your vision, and neurooptometry to work on your vision, and physical therapy to work on your balance, and the list goes on. And we start doing all of these things because now we have identified that you have the issues. So doesn't mean you don't have the brain injury. Kind of getting back to that one. That brain injury is still there. We still have to get better from it. But getting back to work is just that next step in your recovery. And again, those hours might look different when you first get back there. That next step in here is that the next bullet point I had for myself to talk about is needing to listen to your body. So I kind of got ahead of myself a little bit. But again, so many of my patients do get really good at listening to their body, but they're not always great about taking breaks when they need them. So that's the part that I want you to think about on this one, is that making sure that you take the breaks when you need them. And the one thing that my therapists are always telling me as I was going along, PT, OT, speech, all of them were telling me to take breaks before I needed them. And what does that mean? That means you don't work through your breaks and your lunchtime like you did before. I don't know how many times I've had patients come in and tell me, oh yeah, I used to just work through lunch and work through breaks. I wasn't that person that took breaks. I'm like, well, you need to be now. So now you are that person that's going to take breaks because you need to let your brain heal. You need to take a step away from what you're doing. And that's also one of the biggest accommodations that I write for people when they're getting back to work, is to take a short break every hour or every 2 hours at a minimum, so that they're actually taking those breaks and getting away from their work area. Because if they're constantly pushing through, they're going to hit their wall faster. They're going to have those symptoms kick in faster. They're not going to be able to get through the day. If they take breaks, take time away from the computer, take time away from that busyness of whatever it is they do at work, and then get back into it, that little break, that little cat nap away from that hustle and bustle of your full-time job or part-time job, whatever it is, that little break is enough so that your brain can get the oxygen that it needs, so that you can stop and breathe and you can think and you can plan out what you're going to do next when you get back to your desk. It doesn't mean I want you thinking about your job the whole time while you're on your break. I want you thinking about what's the next thing that I have to do, so you're prepared for it and you realize how much of a break you actually need to take before you get back to that thing. So you are now that person that takes breaks. You are now that person that sits down and has a lunch break and stops what you're doing for your work so that you can have that break, have that brain break, because you need that. I remember when I was first working as a nursing assistant, I was a little bit jealous of the people that smoked because they got their breaks all the time. And as a non-smoker, I didn't get all those breaks all the time. And then one of my friends started taking gum breaks. And I thought that was brilliant because it forced you to do something to get away from your workspace. So if you are getting back to work with that brain injury and you need a reminder, I don't necessarily always recommend gum because that can, if you have jaw issues, that can cause some problems. But take something that forces you to get away from your desk, from your workspace, so that you have to do something to take care of yourself because it's a necessity. You must do that. And the other thing to think about with that is that your gas tank is going to be pretty empty at the end of that workday. What do I mean by that? You only have, again, let me think of it a different way. I used to talk about my brain as a sponge, and you have so much space in that sponge. And when that sponge gets full, you have to squeeze it out and let some things out of it. That's kind of like your accountability for the day, how much you can handle in the day. Your sponge keeps filling up and filling up and filling up. And in order to do anything else, you're going to have to squeeze that sponge out and be able to absorb anything else in that day. So when you first go back to work, especially, don't plan to do anything after work. Don't plan to stop at the grocery store, stop at the gas station, meet up with people for coffee or a drink. Don't plan to do anything like that after work when you first go back, because your gas tank is going to be empty at the end of that workday, if not before. Plan to go straight home after work. Plan to go home and take a break before you do anything else. That break time is just like your break times at work. You need that break so that your brain can ease into the next activity or ease into whatever it is that you need to do. Many people that I see that come in with brain injuries are parents. They have kids at home. They have things that they have to do, and you can't pour from an empty bucket. I know you've heard that phrase before, and it's just like when you fly on an airplane and they give the instructions about when the oxygen masks come down in case of emergency. You have to put the oxygen on yourself before you can try to help anybody else. This is you putting the oxygen on yourself when you get back from work. Take a break. Plan that break when you get home before you do anything else, because you need that brain power to do whatever else it is you need to do, whether it's helping the kids find dinner or making dinner or going to a kids' event or something in the evening. If you have to do something that evening, you have to take a break between work and the activity, especially when you first go back. Over time, that gradually should improve, but it's not going to be an immediate type of thing. You can't just, again, snap your fingers and be right back to work and be right back to your normal activities. You have to gradually get back into all of those things. The one thing I will say about when I got back to work especially is that it felt really good to not be in permanent patient mode anymore. And that's kind of what I started feeling like. So for a year and a half, almost that time frame, I really wasn't doing much after my accident. I think it was just before a year when I was able to do some kind of work, when I started working as the laser technician at Hypercharge, where I was doing those red light therapies myself. But then getting back to being a nurse practitioner, it was 22 months. It was almost 2 years from getting back to work. So getting back to doing something after my injury and then getting back to being a nurse practitioner felt like this huge accomplishment. It was so amazing to do something other than just be a permanent patient, because when your schedule is filling up, and I have patients show me their written calendars. So occupational therapy has worked with them, and they've built these beautiful calendars so that they know when everything is. But their calendars are overwhelming. They have appointment after appointment after appointment with different specialists, different providers, different therapists. They're doing all of these things, and that's their full-time job, is being a patient. And it gets very exhausting being a full-time patient. And regardless of how tired you ever got at your job previously, being a full-time patient is something completely different. So when you have that sense of accomplishment from getting back to work and doing something that you're getting paid to do rather than something that you are paying to do, that is just huge. It's so huge. Like, I can't even really explain it to all of you unless you've been there. And it's different than coming back from like a surgical type of thing. So I've had surgeries before and been out of work and gotten back to work. And yeah, it was a little rusty getting back into so I work in health. I've always worked in healthcare. Getting back into working with electronic medical records. Sure, I was a little rusty getting back, remembering where to click to do things, but I never lost that medical knowledge. I never lost the ability to take care of patients. Getting back to work after a brain injury, when there were months that I couldn't even access my medical knowledge, I would see a medical term and I'd think, I know I should know that, but I can't remember what that means or what it does or how to check for it. There was a long time that I could not access those brain cells. They just weren't accessible. So being able to use them again, even in a part-time capacity, that was amazing. It was like winning the lottery, to be honest. Now, when I get back to full-time, that's going to be another lottery all in itself. That might be the jackpot probably, but it feels good to use your brain in ways that you're supposed to be using them again. And again, it's like I said earlier, getting back to work is like therapy. So all of those assignments that occupational and physical and speech therapies were giving you, you're doing them on a regular basis when you get back to work. You're doing them in real life. And that's where some of the best therapists that I've seen in my practice over the years have been the ones that do the things that are like real life. So it's like the YMCA commercials. I like to say that too. So on the YMCA commercials, they're training you on how to do all these different things, and like working with the battle ropes. That's not something you're going to do on a regular basis. That does not equate to real life exercises. But the wood chop, I had a patient come in the other day and he wanted to get back to chopping wood. I'm like, why don't you do some wood chops with a light weight first, because your balance is not great. So let's do some wood chops with the light weight. before you do the wood chops with an axe that has a sharp end on it, that if you lose your balance, it could hurt you. So it's kind of like that YMCA. You're doing things like the real life experiences, but when you get back to work, you're doing the real life experiences. So it's doing all of those things that you are preparing to do in more advanced fashion. But that said, you might need to do things a little differently than you did before the injury. So one thing that I've noticed is that, especially that I've noticed, I used to have this amazing memory, just amazing memory. And I can talk about it and brag about it now because I don't have that same amazing memory. But when I would work in the hospital, we had some really busy days, and some days I'd have 14 patients to myself, usually anywhere between 8 and 14 patients that I saw myself in the hospital. And in that time frame, I would sit down, review everybody's charts. I had my little cheat sheet, my little list, my brain, as I called it, with all my patients' names on it. And I would put down a few little details, MRI negative or whatever. So I reminded myself they had an exam that I have to review with them when I get there. But that was about it. I didn't write down all the details about the patient. It was in my brain. I remembered it all. And I would go see all of them and assess all of them. And sometimes I would write some orders as I went, but I didn't write notes as I went. I would sit down after I saw everybody, after I'd done exams on everybody, after I'd done interviews on everybody, and I remembered all those details to write all of those notes. I can't do that anymore, not even with one person. So I keep saying I need to do an episode like a brand episode and see if I can get some reimbursement. But this little Remarkable tablet, my electronic tablet, my husband got me that as part of my recovery and getting ready for coming back to work. And it has been a lifesaver for me. I have spent 2 years with this baby and it does not leave my side. It pretty much goes everywhere with me because I have my calendar in there. I have my shopping list. I have any phone calls that I have with people, potential guests for the podcast or potential vendors that I'm going to use for clinic tools. All of that is written in here. And when I see my patients, I take notes on that so that I can dictate afterwards. Now I'm using we have a little AI scribe thing that we're using, which is kind of cool. So I don't have to take as many notes anymore, but I still take myself a few notes to lead the conversation. So all of that goes in here. I never had to use that before. I never had to write down all of those things because it was in my head. But my practice looks different because in order to do my job efficiently, I need to be able to remember those details. And if I can't remember them, I need to have them written down. And that's what I do. So everything gets written down so that I can appropriately take care of patients. And when they have questions for me, when we're talking about work accommodations as we go through, I take notes on that for myself so that I can go back and write them the note that they need for work with those accommodations. And I'm writing it down as we talked about. So I'm not writing it down based off of memory that might be erroneous, and I'm not remembering things the way we talked about them. I'm writing it down based on the conversation, because if you ever see like a hierarchy of how you learn things or how you remember things, if you verbalize something, yeah, you're going to remember a certain percentage of that. If you write it down, you're going to remember a higher percentage of it, especially if you verbalize it and you write it down. You're going to remember a higher percentage of it. If you verbalize it, write it down, and then talk to somebody else about it, that also increases your percentage of memory of that information. So doing all of those things, when we talk about it, when I write it down, and then when I read it back to the patient to verify that I got everything right, all of those things helps me remember it so that when they come back in to see me for a follow-up appointment, I'm more likely to remember those things that we talked about last time. I maybe don't remember every detail, but I can look back at the note and I'm like, oh yeah, I remember that. And then I can remember more about them. And as they're sitting in front of me, things click because I had written them down previously last time. And all of a sudden I'm like, oh yeah, you were doing this last time. They're like, yeah, good job. How did you remember that? Yeah, I wrote it down before. So that's how I remember those things. So you might need to do things a little bit differently than you did before in order to be as successful as you were before. So I'm still doing a great job with my patients, but I do it in a different way to remember all of those things. And then aside from like these little electronic notebooks, there are plenty of other assistive devices that might help you do your job better when you get back to work. A lot of them include dictation. So whether you use some sort of tool on your computer that you can do talk to text, I just recently learned that Microsoft has this dictate button. I don't remember that ever being there before. Of course, I didn't really need it either, but Microsoft has a little dictate button. You can actually talk to text. Is it perfect? No, you're still going to need to go back and do some corrections on it, but it will save you so much time if you maybe aren't as fast as typing as you used to be. And I remember when I first learned typing, when I went to school and we learned typing, it was on a typewriter, not a computer. And you could only make so many errors and still get a passing grade on the final test on that. So I did a phenomenal job. I was one of the fastest typers in the class. I think I was in the top 2 with like 1 or 2 errors, very, very few errors on it. And I was super fast. And even in my work before my brain injury, if I did have to, when I did do clinic time previously, I could type and talk at the same time. That's how I knew I had a concussion at one point, because I tried going to work and I couldn't type and talk at the same time. But now in work, I don't do quite as good of a job typing and talking at the same time, but it's definitely slower. So when I'm writing out my after visit summary instructions for patients, I have a lot of dot phrases for myself. If you use Epic or that electronic medical record, you know what dot phrases are. Those are those little transcribed document. They're little things that you write in there that you have a dot whatever, and that's your recognition for vitamin D level, whatever it is that you have your little dot phrases for. So a lot of the things that I do commonly, I have those dot phrases, so I can just put dot whatever, a couple little letters in there, and it has my whole phrase, so I don't have to type it out every single time. But tools like that help to make your job so much easier. And so talk to text, have a screen reader. There are apps on your computers that can read it for you. So if you're getting text messages, if you're getting something else, it can read that for you. Because sometimes hearing something is easier to understand than reading it. That's often a case with patients. And when I was having difficulties with processing what I read, what I heard, hearing was still better than reading it. So that's still a thing. And sometimes I still wish that there are things that I could read instead of having to, listen to instead of having to read, because it is easier to process some of that now audible rather than visual reading it. There are screen covers. So other than the screen readers, there are screen covers that can put a certain tint over your computer screen so you're not having that bright light shining into your eyes. There are light dimmers in your room that you can get in your office. Some people that are in cubicles have those little umbrella things that can block the big fluorescent lights. So a lot of those things can be useful for helping you in your day-to-day life, make you a little bit more productive, make you a little less symptomatic when you go back into the workplace. And then the simple things like earplugs, glasses, those can be helpful as well to kind of decrease some of those symptoms that might come up from being in that busy workplace. The work itself might look a little different. So how you do things might look different. The work itself might look different. And I say that from personal experience on that one, because I used to work in the hospital all the time. Early in my career as a nurse practitioner, I had a job where I did clinic and hospital, and then another job right after that where I did clinic and hospital, but then it was all hospital. And prior to being a nurse practitioner, it was essentially all hospital. So I didn't do other than those few years. So I loved the pace of the hospital. I loved being able to take the time that I needed, because if I had a patient ICU that was intubated and no family was around, it didn't take me long to do my assessment and review all the medications, place the orders that I needed to, even place a phone call to family members. None of that took very long to get all the information that I needed. Versus if I went to see somebody for a new consult and I needed to spend an hour with them, I spent an hour with them because I could, because some of those other appointments, or not appointments, but other patients would only take 5 or 10 minutes. So I could take the time where I needed, and I wasn't set on a time schedule that I had to be going to get people at certain times. That was always my least favorite part of working in clinic, was having this time frame that you can only see patients within this time frame. And once that time is up, you need to get them out the door because you need to get the next patient. And I never wanted to go back to that. And here I am in clinic because the hospital was too overwhelming for me. Too many noises, too many lights, too many people, too many bodies bustling around in the hallways. I couldn't focus. I couldn't comprehend what was happening around me at all times. And it was too busy and I was too symptomatic. So that was not going to be a situation that I was going to get back into at that point. And I don't know that I'll ever be able to be honest, because I'm much more sensitive to those things than I used to be. So will I ever work in the hospital again? I don't know. Possibly not. And at this point in my life, I'm okay with that because I really, really love what I'm doing in clinic, even though I didn't think I was ever going to want to do just clinic. But I really, really love what I'm doing working with the concussion patients and helping other people that have had a traumatic brain injury to be the best version of themselves that they can be post-injury. Some of my patients end up working from home. And if it's a possibility to work from home from their job, I write that accommodation to get them there because they need to try to get back to doing that job, but they need to do that job with the least amount of distractions and other hypersensitivities annoying them, honestly, at their job. So whether that be the lights, the sounds, the smells, all of those things can be very overwhelming to an injured brain. So if you want to see if they can get back to work, allow them to work from home if possible. So for some patients, working from home is going to be the next best thing, but it might need to be in a different setting. So I've had several patients that have come from working in home care or working in schools. They might be working with people who have special needs and they need to work in a different setting. So I've had several patients that work with the students that are special needs and they are very volatile and they are very physical. And some of those patients have had now multiple injuries. And we've had the conversation about whether or not they should be actually going back to that situation. And some of them have gone back to different settings where they're not working with those violent students and they're at less risk of having another injury. So change in a setting, change in a work setting might be necessary to keep you safe so that your brain can heal and that you don't have a subsequent injury. And then some people might need to take on a new job completely. I have some patients who, will they get back to the job they had before? Maybe not, because it was very physically demanding and they might not be able to, but their cognition is doing better. So could they do any job? Absolutely. Can they go back to the one that they were doing before? Maybe not. So we're starting to have some of those conversations on what does it look like? Can you get back to that job? And I've had a couple patients work with vocational counselors to try to help them find a job that they can do with the skills that they have. And those vocational counselors are very important for that purpose, trying to help you figure out what can you do within the limitations that you have now. Because there are so many jobs out there. You have skills. What can we do to utilize those skills to your best advantage? And then some people will find a different sense of purpose. So your likes and dislikes can change after a brain injury. That includes what you like and you dislike in work. And that might not be something that you realize before you get back to work. So for some people, they realize before they get back to work that we need to have a change in setting or a change in job completely. For some, it might not be until after they get back to that job, they realize this really is not a fulfilling job for me anymore, and I need to look for something different. So that also might be the case. So all of those things are possible after a brain injury, and all of those things are things that we need to take into account. I cover a lot of these different bullet points here as I just put them out on my paper to prepare myself. I cover a lot of those different topics as we go through our visits in the concussion clinic because the questions come up. What does it look like? How am I going to get back to work? How am I going to be ready to get back to work? Am I going to be able to get back to work? And I do bring up my personal experience a lot. I used to work in the hospital and now I work in the clinic. So it looks a little bit different. It doesn't mean that's a bad thing. It's just different. And that's where I'm a little bit different than other providers is that I've had that personal experience and I can help you understand it from the perspective of somebody who's been there, done that. I can give you my personal experience and help you to try to make the best decision that you can in that place as well. So all of this to kind of wrap up, and what does it look like getting back to work with a brain injury? Is it possible? Yes. Might it look different than before? Also, yes. And are those bad things? No, they're not. It's always a good thing when we can try to get somebody back to their job. It's always a good thing if we can get somebody back to a job. I'd rather have you have a job than no job because that will be better at paying your bills. But I want you to find something that's going to give you a sense of purpose. And that's where we have those conversations of what brings you a sense of purpose now. My sense of purpose changed. Funny thing is, I got to thinking about it, and I've been a stroke provider for years and years, and I totally forgot until recently that my very first job in healthcare was in a group home for adults with traumatic brain injuries. So I have come full circle without even realizing it. I guess that's where I was meant to be in the TBI world. I just didn't know it at the time. So took an accident to help me figure that out. I hope you don't have to experience some sort of brain injury in order to help you find out what you want to be when you grow up. But this definitely gives you an opportunity to stop and recalculate, rethink, how am I doing? What am I doing? Am I doing what I want to be doing? Am I doing something that brings me purpose? And that's what getting back to work after TBI looks like. Do you have that sense of purpose? So thank you guys for joining me today. Again, if you have requests for topics for future interviews or future solo episodes like I do every once in a while here, please drop me a line. And again, if you like what you're hearing, subscribe to it on whatever service you're listening to or watching it on. Leave me a comment, leave me a review, help me get more listeners so that more people can hear these conversations. Thank you and have a great rest of your day. Thanks for tuning in to this episode of Brain Wellness, the podcast. If you enjoyed this episode, I encourage you to subscribe, like, and share this with others to help me continue on with my mission to help people live healthier, happier lives. Go to www.brainwellnesssolutions.com to see what I'm up to and get links to all the social medias there. See you next time.